7 years ago today, President Obama signed the Affordable Care Act. When it was signed, opponents said it would destroy the U.S. healthcare system and kill jobs. Instead, ACA has held down increases in healthcare costs, improved the quality of health care, given health insurance to over 20 million people. Because of that success, some House Republicans, determined to kill the ACA. They can't stand the proof that they were wrong, and they will vote on this repeal today. But the Republican bill does much more damage than just repealing the ACA. It also shifts Medicaid to states which can't afford these costs. That's turning back the clock to before 1965 when Medicaid was passed. For over 50 years, Medicaid has saved countless lives and eased the sufferings of millions. Medicaid mainly serves elderly people in nursing homes, the disabled, and young children living in poverty. President Trump has said that they need to pass this bill in order to get a tax cut. Those tax cuts will go to people who are already wealthy, who don't really need a tax cut. So today, we have a question for every elected official in Washington. I hope you will ask this question of them too. The question is, do you really want to take health care away from the poor, the elderly, and the disabled just to give a tax cut to rich people? This is cruel and it's wrong. I don't have to vote on this bill, but I will use my voice, to shame anyone voting for this bill. So I'm asking all of our representatives in Washington to vote no. Also want to say, I just want to make sure, and this is some of the things that actually gives me some belief that our democracy will prevail and we will continue on as a country. And as we see each day, there are courageous Republicans in the House who are stepping forward to be clearly against the bill. And I just want to recognize Congressman Dent and Congressman Fitzpatrick and Lobiondo from South Jersey and Thompson for their courage and their intelligence in stepping away from the aura of Donald Trump and doing what's right for Americans and right for the people who live in their district. So with that, I want to take the opportunity to introduce for more detailed information on this impending disaster, our Health Commissioner, Dr. Farley.
Thank you and good morning. We've talked before about the impact of the repeal of the Affordable Care Act. Just to hit the high points in here, this would cause in the nation as a whole 24 million people to lose health insurance. Here in Philadelphia, we estimate that it'll cause 220,000 people to lose health insurance. That's 1 in 6 adults. And it will mean that everyone else will pay more for less care. Now, there's a number of speakers who are going to follow me who are going to talk more in detail about the impact of the repeal of the Affordable Care Act on Philadelphia and on the organizations they represent. But as the mayor said, the plan today goes beyond just repealing the Affordable Care Act to fundamentally transform the Medicaid program. And so I want to talk just a little bit about Medicaid for those people who don't understand what this program is about. A little background. The Medicare program is a program that provides care for the elderly. It pays for their hospitalizations, it pays for their outpatient services. This is a federal-only program. By contrast, the Medicaid program is a program for poor families with children, for the disabled, and for low-income elderly people who need nursing care, either at home or in a nursing home. With the Affordable Care Act, the Medicaid program was expanded to provide services to low-income adults without children. Many of those have low-wage jobs that don't offer health insurance. The Medicaid program, unlike the Medicare program, is a joint federal-state program where there's matching dollars between the two levels of government. For the last 50 years, the Medicaid program has been a core program for health care coverage for the most vulnerable people in this country and in the state and here in Philadelphia. So we put together a one-page summary of the impact of the Medicaid program. In case you're interested, it looks like this, and we've got copies for you. But just to give you some of the statistics, to give you a sense of the impact of this here in Philadelphia, Medicaid in Pennsylvania covers 2 in 5 children. It covers 1 in 8 seniors, mainly people who are getting nursing home care or services at home that keep them out of a nursing home. It covers 3 in 5 nursing home residents. It covers 1 in 2 people with disabilities and 1 in 3 deliveries of newborns. 72% of Medicaid funding is for seniors and people with disabilities. Medicaid is also critical to our response to the opioid epidemic. It's been estimated that in Pennsylvania that 50,000 people who newly became eligible for Medicaid under the Affordable Care Act have opioid dependence and will rely on Medicaid for treatment for opioid dependence. Now, here in Philadelphia, Medicaid covers more than 600,000 people. That's about 40% of the population of Philadelphia. So this is the program, this safety net for care, that some of the Republicans want to cut so that the wealthy people can pay less taxes. They want to cap the federal share of their payments. They want to shift the cost to the state. And they want to cut the federal share for the expansion population so that those people ultimately will lose care, those low-income workers. All this will mean that fewer people will be covered, and those people who are covered will get fewer services. That's going to put the state and the city in the agonizing position of having to make decisions like this. Whose services are we going to cut? Those for an 85-year-old woman in a nursing home? Or those for a newborn being born who's from South Philly? Or those of a 24-year-old who was severely disabled with autism? Now, in the last 24 hours or so, my understanding is that they have added additional requirements to this bill that at least some states, they will require people on Medicaid to work to get the services. So I ask you this, who of these people do they expect to work? The 85-year-old woman in a nursing home, the newborn from South Philly, or the 24-year-old with autism? So as a doctor, I can say this bill is not about health care. This bill is about cruelty. It hurts the people who deserve our care the most. It's wrong for Philadelphia, it's wrong for Pennsylvania, and it's wrong for the country. So that's a discussion of Medicaid. And now I'd like to introduce a person who's going to talk about the impact of the Affordable Care Act more generally on himself. Bob Finkelstein is a videographer from Philadelphia who has lived with multiple sclerosis since 2003. He has purchased insurance on the individual market, pre-Obamacare and post-Obamacare over the past 14 years. He's going to talk to you about his experiences. Bob?
Hi, my name is Bob Finkelstein, and like tens of thousands of other people across the state of Pennsylvania and in this city with serious and chronic conditions, my life is literally hanging in the balance as Congress votes on the American Health Care Act, both my physical and my financial health. I was diagnosed with multiple sclerosis in 2003, and I don't know if many of you know what multiple sclerosis is or what it does, but it's a condition where your white blood cells attack the tissues of your brain and your spinal cord. The only thing standing in the way of those attacks right now is the medication that I take. If I don't take this medication, my immune system could attack my spinal cord again, it could attack my brain again, and I could become paralyzed. I could lose my vision, and I could die a lot earlier than I would have if I was taking the medication. This is what's at stake for me, and it's what's at stake for thousands of other people like me in the city and across the state with a whole range of conditions that require extensive and intensive treatment. This medication that I take, like many medications for serious and chronic conditions such as cancer and hepatitis, is extremely expensive. It costs $80,000 a year and continues to increase at the insane rate of 15% to 25% a year. If the American Health Care Act passes, I am no longer certain, as I am today, that I will be able to afford this medication. Speaker Paul presentation at the beginning of the month trying to educate people about why his new plan is so great. My education about why his plan will kill people and bankrupt families came in a little bit of a different manner. My education started when I was sitting in a doctor's chair hearing the words that nobody ever thinks that they're going to hear. And that's, "I'm sorry, buddy, you have multiple sclerosis." My education on these issues has been ongoing over the past 14 years since I walked out of that doctor's office. I've purchased health insurance on the individual market, both pre- and post-Obamacare, so I've lived all the changes that they are talking about. I know that if insurance companies are allowed to sell low-quality policies like they did before Obamacare was passed, and like the Republicans want to allow, that I and many other people will not be able to afford the cost of our medication and other necessary services. Right now, my total health care costs are capped at about $12,000 a year, thanks to President Obama's very sensible reforms. If I had to go back to the old insurance policy I had before Obamacare, I would be required to pay 40% of the cost of my drug. That means that I would be paying $32,000 a year just for the cost of my medication. And that would be about, total cost would be about $45,000 a year with premiums and other co-pays. I work up to 60 hours a week as a videographer, and it is insane to me that I would not even be able to come close to affording my health care on what amounts to a middle-class salary. On the other hand, I know that it's dangerously misleading to families across the state and country that Speaker Paul Ryan is saying that the tax credits and health savings accounts he is proposing will somehow cover these costs. They will not even come close. What he is proposing only helps families who know they are never going to get sick. They won't realize why these policies won't work until it's too late. But as I said, I am not the only one who faces this issue. There are thousands of people across the state who can speak to the exact same thing that I am saying, and there are thousands more families, young and old, across the state who in the not-too-distant future will come to understand these issues in the same way when they or a loved one is diagnosed with a serious illness. I would like to ask Speaker Ryan what he is going to say 2 years from now to that family when they walk into his office and the father looks at him with tears in his eyes and says, "My child died because I had an insurance policy that didn't cover the care he needed," or "My family had to sell our house and lost everything we had because we weren't covered and we had to pay for the necessary medical care to save our child's life." That doesn't happen now because of the protections in Obamacare. What will the Speaker's answer be when the blame is laid at his feet? Although it's been easy to attack Obamacare, it has in fact been a giant leap forward in guaranteeing affordable health care for people across this country. Capping out-of-pocket annual expenses, removing lifetime limits on insurance, and income-based subsidies work. They were all smart, well-thought-out reforms. What Speaker Ryan is suggesting is bringing us back to a time when even people who had health insurance were dying and going bankrupt because they were denied services and did not know that the health insurance policies that they had were inadequate until it was too late. The only thing we can afford is to go back to this system. Too much is at stake for the families of Philadelphia, Pennsylvania, and this country. Thank you.
Thank you. Among the greatest impacts of the Medicaid program and the potential for change in the Medicaid program is on patients who have mental illness or substance use problems. To talk more about that impact, we have Deputy Commissioner from the Department of Behavioral Health and Intellectual Disability Services, Roland Lamb.
Good morning. The Department of Behavioral Health and Intellectual Disability Services provides services for children, families, adults with mental health and/or substance use challenges, intellectual disabilities, and autism. It is also a safety net for the uninsured to access behavioral health treatment. Our annual budget is about $1.5 billion, most of which is Health Choices Medicaid program administered by the Community Behavioral Health, as well as state-based and federal block grant dollars to support those that are uninsured. The impact of the ACA repeal without an alternative replacement, which is the worst-case scenario, is that we will lose over 220,000 Philadelphians who will become uninsured. More than 160,000 adults and children will be disenrolled from Medicaid expansion. Nearly 60,000 adults and children who have purchased health care through the marketplace will also be displaced. Of the over 160,000 adults and children currently covered under Medicaid expansion that will lose their coverage, almost 25% or 40,000 are members who are currently utilizing behavioral health care services. Among those individuals, there is significant usage of substance use disorders services, including non-hospital rehabilitation and intensive outpatient services. Additionally, 1,000 individuals living independently in our community through our permanent supportive housing program would be directly impacted if the ACA is repealed without effective replacement. These formerly chronically homeless individuals with serious mental illnesses and/or substance use disorders would lose access to critical Medicaid reimbursable behavioral health services. ACA expansions of Medicaid coverage and access to private coverage have provided critical support to treating behavioral health conditions, as state and local funding outside Medicaid dedicated to behavioral health care has declined. An ACA repeal without effective replacement would put pressure on states and localities to cobble together funding for behavioral health services for the uninsured. No matter the maneuvering, neither DBHIDS, the City of Philadelphia, nor the State of Pennsylvania will have a way to recoup the total loss in federal treatment dollars. It is impossible for the department to render enough funds to meet the demands of all the individuals who will become uninsured, more than 220,000 if the ACA is repealed. Since there will be a deficit of grant fund dollars if the ACA is repealed, the department must reprioritize allocations to bolster treatment funds to cover the uninsured. Therefore, the department would no longer be able to use allocations to address major Philadelphia priorities. Challenges, for example, would be rolling back investments in population health initiatives, including services for prevention and early intervention for substance use disorders in adults and adolescents, rolling back investments for evidence-based practices, and limiting core services for individuals in permanent supportive housing. The ACA, coupled with the 2008 Mental Health Parity and Addictions Equity Act, made huge advances in improving, ensuring behavioral health treatment. Increased access to insurance by expanding Medicaid eligibility, allowing young people to stay on their parents' plans up to 26, and providing financial subsidies to help people afford insurance. If the ACA is repealed, young adults who currently are on their parents' plan would become uninsured and need to access limited county funds for behavioral health services. Close gaps in insurance coverage by eliminating annual and lifetime benefit limits on behavioral health services and ending discrimination based on pre-existing conditions. If the ACA is repealed, individuals with serious mental illnesses and substance use disorders would yet again be the subject of discrimination in private plans. The ACA made treatment more affordable by prohibiting higher co-pays for behavioral health services than for physical health services. The ACA recognized that behavioral health treatment is as important as physical health conditions by prohibiting insurance plans from imposing more restrictive caps on the number of behavioral health treatment visits than on similar physical health plans. The ACA insurance eligibility is only part of the equation. Insurance must include the right benefits, because insurance is really not care. Before the Mental Health Parity and Addictions Equity Act and the ACA, health plans routinely did not include substance use disorders, or they had very tight constrictions on what they covered and how long they covered it. The Mental Health Parity and Addictions Equity Act required most health plans to cover behavioral health conditions at the same level as physical health conditions. But the ACA went a step further, requiring all health plans in the individual and small group markets to provide a package of essential health benefits and include substance use services as an essential health benefit. The ACA not only enabled more Philadelphians to access health coverage by expanding Medicaid and providing subsidies for coverage in reformed individual markets, it also expanded access to behavioral health treatment services through its provisions for people with Medicaid marketplace or employee health insurance. We must fight to maintain Medicaid expansion. It makes combating the opioid epidemic possible in Philadelphia. Insurance coverage is vital to treating substance use disorders, including addiction, and the ACA made recovery possible for many Philadelphians. I should note here that between 2002 and 2013, the number of people who did not have insurance who became addicted to heroin increased by 63%, whereas in people on Medicaid, it only increased by 4%. If the ACA is repealed and ultimately replaced, it is imperative that any replacement has parity for mental health and substance use disorders, and we cannot regress. Thanks to the ACA, the department has been able to reallocate safety net funds for population health initiatives such as early intervention programs for adults and adolescents who are at risk for developing substance use disorders. Repealing the ACA would be an intolerable injustice to the city and our responsibility to keep investing in our own health and well-being. So thank you very much for your time.
Thank you. And here to talk about the impact of the ACA and potential repeal of the ACA on working people is Pat Eiding, who's the president of the Philadelphia Council of the AFL-CIO.
Bob, thank you for your courage, and I wish you well, because I know what heroic people who have MS are. They fight every day, and they go to work every day. So I want to thank you for standing here with us. And my message, quite honestly, is to the working people of this country, whether you have the benefit of a collective bargaining agreement or you don't have. I represent over 150,000 working families in this city of Philadelphia and around Philadelphia. And I also think that we work hard every day for all working people. This is a tragedy that many of my members who are fortunate enough to have a good health plan are not recognizing what it does to them and their family and what we'll do. Imagine these people who claim to be so close to God are now saying, if you're on Medicare, pick up your crutch or your cane and go to work and make yourself valuable because you don't deserve to have any help in this country. Imagine the older folks who worked all their life, and some of them, by the way, because of the country and how we've disregarded them and their pensions and those things, are working at McDonald's and other places. Now we're going to tell them it's going to cost them a lot more to have health care. Just imagine that. If you're working and you're fortunate enough to have health care and you have the luxury of a collective bargaining agreement, keep in mind one thing. The same people who want to take away health care from millions of people in this country are the same people who want to take your right away for collective bargaining. So don't be fooled by the promises. Don't be fooled about this idea of a greater America. This is a great America, and those people you elected are people who should be caring about you when they're in Washington, not forgetting. So I certainly respect, and we don't represent Democrats or Republicans. As I said, we represent working people. So those folks that have the intestinal fortitude, like Biondo and Fitzpatrick and others, to stand up for the people who they represent, and not those right-wing people down there that are trying to pressure them into something. And, I will say to all those folks out there who claim to be so close to God, take a minute and look around at what you're doing to our people. And to my brothers and sisters who are working every day, have the benefit of health care, please don't be blinded. This is going to hit your fathers, your mothers, your uncles, your aunts, and your next-door neighbor. We have to get to our representatives and tell them not to be doing the kinds of things that are being represented down there in Washington right now. All working people should stand up. Thank you.
The ACA will have a ripple effect in many ways. Here to talk a little bit about the healthcare system is Patricia Aiken, who is a registered nurse and the president of the Pennsylvania Association of Staff Nurses and Allied Professionals, a statewide union of more than 8,000 nurses and other healthcare workers.
Good morning, everyone. My name is Patty Aiken. I am a registered nurse. I spent 17 of the last 18 years working as an emergency room nurse at Temple University Hospital. I am thankfully retired. To try to write this speech was very difficult because I didn't know where to start. It's highway robbery. We are all being robbed. And it's at the expense of people who, as everybody before me has already said, of people who can hardly afford it. It's going to be terrible for us because the most vulnerable, who are disproportionately in this city, black and brown people, are going to be hit the hardest. And there's no way to say it except that people will die. I think Bob pretty clearly laid out what happens when you have a chronic illness. But ultimately, people will be coming into our emergency rooms who have self-rationed their care because they can't afford to see a doctor anymore. And they will come in with very expensive illnesses that could have been treated before. For example, if you have high blood pressure and you can treat that fairly easily with doctor visits and pills, if it's not treated, you end up with strokes, with heart attacks, and on kidney dialysis, which is extremely expensive. Also, they're picking on the elderly because they have increased what the cost is going to be for older people who are pre-Medicare. Well, maybe they don't know, but it is a fact of life that the older you get, the more likely you are to be ill. So, as people are older and sicker, And the cost comes to hospitals because people will come in and they will be sicker and have more expensive illnesses, and they will not have the money to pay for it because they won't be insured anymore. So what's a hospital supposed to do with that? At Temple, they had calculated, and I don't want to speak for Temple, but I know that they put this out, that they had calculated that the repeal of the Affordable Care Act would cost them $45 million. And it looks like this replacement is not much better. $45 million a year is not absorbable for our safety net hospitals. So what we're going to see is a huge impact on the city, because people will be, from all these hospitals, there's going to be staff cutbacks. I predict layoffs, and that means that the care inside, as they try to figure out how to handle the reductions in staff, you're going to have longer waits in the emergency room. You're going to have when you're in the hospital and you're a patient, one of the things we fight for all the time as registered nurses is safe nurse-to-patient ratios, so that we can actually get to care for you in your room, that we're not in 3 other rooms trying to balance the care, that we can be there. That's going to be worse. It's become better under the Affordable Care Act as hospitals have had the resources to improve staffing. That will go away, and that will affect not just the people on Medicare and not just the people on Medicaid, but that will affect everybody. That will affect all of you. In addition to quality going and all that detriment to patient care for us, we're going to find out that those of us who have, as Pat said, who have employer insurance, there's a prediction that at least 300,000 people across the state are going to lose their employer insurance, because part of the Affordable Care Act said that if you were an employer with a certain amount of number of employees, you had to provide insurance. That will go. More people will begin to lose insurance. And so what's going to happen is that as hospitals and insurance companies try to absorb these costs, they're not going to absorb them. They're going to pass them on to everybody. Everybody who thinks they have good health insurance is going to find themselves with higher deductibles, more copays. There's no reason why they can't start charging you copays when you even make a phone call. I can remember the first copay for somebody getting a CAT scan. Remember back in the day when getting a CAT scan, you didn't have to do a copay. Now you have to copay everything. They'll probably start charging you copays just to walk in the front door. And people will find that their insurance is going to go sky high. So this will affect everybody. This will affect the tax revenue for the city. This will affect jobs. This will affect healthcare. This will affect everything. Also that, as far as I can see, also that some rich people can get richer, because what I have found that lots of people say, well, you always say that Republicans are for the rich. This law actually had taxes. The Affordable Care Act had taxes in it that tax the rich, that tax capital gains. Some of us aren't even sure what exactly is a capital gain. But that's money that rich people have. Most working people in the city of Philadelphia aren't going to have their capital gains. They're not going to make money on capital gains. And there was a special tax on people who made more than $250,000 a year that went straight to Medicare. So it's going to affect everybody. And one last point, and then I'll go, is that the Affordable Care Act also had a huge positive effect on Medicare. It increased the prediction by the Medicare Trust Fund that Medicare would be solvent for another 15 years, I believe. Now, with this new Trump and Ryan Act, it will reduce it back to merely 7 years. So everybody who's on Medicare who thinks, this doesn't really affect me because I have my Medicare until I die, you should look again. In summary, I'll say that I'd just like to quote Woody Guthrie, who most people have heard about. And he said, some will rob you with a 6-gun, others with a fountain pen. Those people, those Republicans in Washington who are trying to ruin lives and take money in the process, We really should be totally enraged about them, and everybody should be fighting to make sure that this law does not pass. Thank you.
Thank you. And here to get a perspective from one of our elected representatives, we have Representative Maria Donatucci, who represents Pennsylvania's 185th District.
Good morning, and thank you. And I just want to let you know that Jared Solomon, representative, has joined us also today. And I want to acknowledge that he's here. Good morning. I will be very brief. Since the advent of the Affordable Care Act, we in Pennsylvania have seen our rate of insured residents increase to about 94%. It's a historic high. But that progress stands to be undone by proposals to repeal the act. And I'm here today to join my colleagues and others in urging Congress to reject such an action. The Trump Care proposal would have a devastating effect on residents of Pennsylvania and in the rest of our country. Our senior citizens could see health insurance costs skyrocket and it will skyrocket beyond their means because Trump Care would allow insurance companies to charge them up to 5 times what they charge younger Pennsylvanians. Children could lose access to vaccines and adults could miss out on cancer screenings, as Trump Care would take away millions that our state and local health departments use for providing those important preventive services. And with the proposed cuts to Medicaid, more than 1 million people, including some of our most vulnerable residents, would lose their coverage. The cuts would cost Pennsylvania as much as $3 billion a year, leaving the state to decide whether we can pay for health care or schools. That's just an example. Trump Care might help the wealthy and the insurance companies, but our working class families, our children, and our seniors will be the ones who suffer. Repealing the Affordable Care Act would have tragic consequences, and I hope that our representatives in Congress recognize that and vote against the proposal until you can make it a better one for all people. Thank you.
Thank you. I'd just like to also acknowledge a couple other elected representatives. We have Councilmember Heenan, who's here, Councilmember Taubenberger, who's here. Is there anybody else who's here who we need to acknowledge? Yes, Representative Solomon. Yes. And then we're available for questions. All right. Thank you very much for coming.